Welcome, everyone, to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health, reporting for the week of July 21st, 2025. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. After a brief public health update, we will be talking about long COVID, some updates, as well as an incredible overview of some highlights from Dr. Zeest, our special guest for today. Let's start out by taking a look at respiratory viruses, weekly percent positive. And we can see that COVID in the red line is really the only virus that is increasing right now in terms of its share of respiratory illnesses. And again, this is folks who go to a healthcare setting to be tested, so still more likely to be the common cold or rhinovirus, enterovirus, but COVID is increasing in terms of its share of tests being done in clinical settings. And taking a look at wastewater, we can see that it's still low, which is good. It is lower than it was this time last year, but it is heading up. So the question really is, how high will it get? The highest currently is in the western region, which is in teal, followed by the south, and both of those are increasing, where the Midwest and Northeast are still very low and still flat. So we'll continue to keep an eye on this. When we take a look at epidemic trends, and remember, this is looking at emergency department visits for COVID, and this gives us a pretty good sense of whether things are increasing or not. And it's a pretty early indicator because it's emergency department visits. And those in purple and in dark purple are growing or likely growing. So that's many states across the United States that are growing or likely growing. All of those in the gray are not changing. And when we take a look at hospitalization, we can see that as of July 12th, COVID in the orange line looks like it's coming up just ever so slightly, but it is still pretty low and flat. So this is something to keep an eye on, especially as we see wastewater and epidemic trends increasing. We do expect hospitalizations to increase, but again, a question of how much. And looking at deaths, we did have a slight increase for the week ending June 21st. So this is about a month lagging behind. 168 deaths. So this is still much lower than we've been this entire pandemic. We've been breaking record lows every week for several weeks now. So this is good news. And going up from 153 the week ending June 14th to 168 the week ending June 21st. Not sure if that is just a blip or if it will turn out to be a trend. We will see as more cases are added, because as we know, those gray shaded bars are still incomplete. So overall, a better picture than we've seen this whole pandemic, really, but something to continue keeping an eye on. Today, we're diving into a topic that continues to impact millions of people globally and demands continued focused attention, and that is long COVID. It is a condition that has challenged our medical understanding in every way, but we do continue to see progress in terms of our understanding and approaches, even if it's not as fast as I know we would all like. So before we hear from our incredibly insightful guest, Dr. Zeest, I want to take a few minutes to briefly review a couple of recent highlights in literature concerning long COVID. One of the most exciting areas, I think, of progress is in identifying biomarkers and understanding the mechanisms of long COVID. There was a recent publication in Nature Immunology from April 2025 that provides some pretty significant new insights into long COVID. So the researchers here conducted a detailed blood analyses and found that specific protein biomarkers are elevated in patients affected with long COVID. particularly those experiencing persistent respiratory issues like breathlessness, where the researchers observed elevated markers of inflammation and cell death. The study also identified a deficit in the so-called humoral immune response, so meaning the body's ability to produce effective antibodies that are neutralizing against SARS-CoV-2. And all of this was found significantly in individuals with long COVID and not in those without. And so the reason why these findings are so important is because when you can identify specific kind of biological fingerprints, if you will, and specific impairments in the immune system, that can pave the way for developing what we so desperately need, and which I know you'll hear from our guest in a moment, is that we could develop needed specific diagnostic tools, like maybe lab tests that could point to the specific diagnosis, as well as perhaps more targeted treatments for this condition. We know that this condition is very complex. It's not one thing, but if we can start to get some indicators on blood work or otherwise, this could really help to point to some of the subsets within the disease or help guide us towards more treatment. So I've linked that article in the post in case you are interested. And beyond the biomarker findings, research is continuing. There's quite a lot of research that is going on in different stages. Clinicaltrials.gov is a great place to go if you just want to explore the different trials that may be recruiting for participants right now, or to keep an eye on some of those studies that are ongoing. But some of the research that is coming out is kind of helping to emphasize the role of viral persistence. So meaning that SARS-CoV-2 virus is lingering in the body, as well as the ongoing dysregulation of the immune system. So this has kind of been replicated and demonstrated repeatedly. And we're learning more about how the virus can continue to disrupt the immune system and lead to sustained inflammation. It can lead to some of our immune cells, like T cells, to become so-called exhausted, or T cell exhaustion, you may have heard the term, and cause imbalances in the cell population of our immune system. We are also gaining a clearer picture of who is most affected and why. So some large-scale studies, including those from the Recover Initiative, which we know is a large, ambitious initiative that I've reviewed in the past year. But we're continuing to refine our understanding of long COVID and who it affects. We now have stronger data confirming that adolescents, those over 65, women, and those who were hospitalized for their acute COVID-19 infection are at higher risk. And even though we know that SARS-CoV-2 has evolved, we've had new variants and so on, the risk of developing long COVID does not appear to have necessarily decreased. So we're still seeing new cases of long COVID. What is clear is how diverse long COVID presentation is, the symptoms. There have been many of them. This kind of leads to some of the challenges that we have in just the basic defining of long COVID, but we're learning more and more and having a better ability to hone in on that. But it all underscores that it is not a single disease, but really a complex syndrome with differing presentations across multiple organ systems. And in terms of diagnostics and potential treatments, we'll hear more about this from Dr. Khan in a moment. We don't have a single cure yet, but the outlook is becoming more hopeful. There are novel diagnostic tools that are being explored, and we're seeing some promising early results from initial trials of some interventions. And significantly, I think the scientific community is recognizing the overlap, although complicated, but the overlap between long COVID and conditions like myalgic encephalomyelitis and chronic fatigue syndrome, or ME/CFS, suggesting that there may be some shared underlying mechanisms that could help inform future treatments for both. So not wanting to lump them into one category, but hoping that we're going to get better as it relates to both. So all of this evolving understanding is critical, and it brings me to our featured guest today. I'm incredibly honored to introduce someone who brings an unparalleled perspective to this conversation, Dr. Zeest Khan. Dr. Khan is not only a highly respected physician, but she also intimately understands long COVID from a personal standpoint. Her insights are truly invaluable and offer a unique blend of clinical expertise as well as lived experience. She generously provided us with a comprehensive 45-minute video, which we'll be sharing with you all very soon, that delves a lot more deeply into some of the nuances of long COVID. But for today, I'm pleased to share a powerful snippet from that recording where Dr. Khan will discuss the critical aspects of the approach to evaluation and diagnosis and current treatment approaches, and a few of the vital components of support and care and advocacy around long COVID. So now let's hear from Dr. Zeest Khan.
Hello, I am Dr. Zeest Khan, and I am happy to collaborate with Roots Community Health to talk to you about long COVID. I am recording from a space in my home where I actually record my podcast. It's called Long COVID MD. In 2020, I was a practicing physician in hospitals during the beginning and the height of the pandemic. I fell ill, and unfortunately, I never got better. In 2021, I had to step away from my practice and dedicate my time to regaining my health. I was ultimately diagnosed with long COVID, and now I focus my efforts in learning more about this evolving condition and teaching others what I have learned and the keys to my own recovery. There is some blood work that can suggest that someone is in a hyperinflamed state, but these blood markers are not designed for long COVID specifically. They were actually designed to follow other disease processes. So we take those with a grain of salt, but they can be data points that helps us get closer to a diagnosis. For those who have cardiac manifestations or new cardiac symptoms, cardiac evaluation is recommended. And then imaging should also be pretty focused to symptoms. It's important that we do two things simultaneously when we have a cluster of symptoms the way that people with long COVID do. It's important not to assume all of our symptoms are caused by long COVID. It's also important to keep the diagnosis of long COVID in mind. So people who have had a COVID infection can have symptoms that are caused or triggered by that COVID infection. People with long COVID can still have malignancy. They can still have heart disease caused by coronary problems. They can still have autoimmune conditions that are not long COVID, and they can still have mental health conditions like depression. All of these can present with symptoms similar to those caused by the acute COVID infection. So we need to be very thorough. We want to make sure we don't miss anything else. If we are diagnosed with long COVID or we suspect we have long COVID, what are treatment strategies available to us? This is another $1 million question. There are currently no FDA-approved treatments specifically for long COVID. That does not mean that there are not treatments available to treat our symptoms. Currently, for long COVID, we really need a combination of lifestyle modifications and interventions, especially if you have fatigue and post-exertional malaise. Rest and pacing is the foundation of your recovery. You make sure that you are not exerting yourself beyond your limits. pace your activities, and that is much easier said than done. It is difficult but important to identify what is most important for you to get done in your day and try to move your life in accordance with that. Diet and stress management, those are always important things and helpful things, no matter what your health status. But some diets can be very restrictive and labor intensive itself, and the stress of trying to stick to that diet and getting the ingredients and preparing those foods can cause you to push past your energy limits. That being said, it is important to hydrate, especially if you have POTS. It might help to also use hydration salts, preferably ones that don't have, really high levels of sugar. But hydration salts can also help with blood pressure management by increasing your blood volume to compensate for your body's inability or difficulty constricting blood vessels to maintain your blood pressure. That's also the reasoning behind using compression stockings on your legs. Some people even use them on their arms. And there are belly binders that can help improve blood return. Medications and interventions should be focused on particular symptoms. There are no FDA-approved medications to treat long COVID specifically, but there are certainly medications FDA-approved to treat headaches, to treat sleep disruption, to treat changes in blood pressure and heart rate. So we want to really focus in on what our symptoms are and assess all of the resources that are available to us and use them for our specific needs. It's not just medications and medical interventions that are going to help. Long COVID treatment really benefits from a team approach, and I have benefited from using physical therapy, occupational therapy, and speech and language pathology resources to help improve my function. With any medical specialty, it's really helpful to be honest about what your physical limitations are and ask to have a very slow approach to any sort of rehab. You are not likely to exercise your way out of long COVID, particularly if you have a fatigue component there. Remember, you may have real problems with your mitochondria and your ability to generate energy. And sometimes you're just going to push yourself past the edge. If you do that enough times, there is concern that you may worsen your health actually, and possibly for a long period of time, if not permanently. So physical therapy can help with body dynamics, body mechanics, and some strength training, because being in bed really does run the risk of deconditioning. Long COVID is not itself a disease caused by deconditioning, but physical therapy must be approached very carefully because you don't want it to turn into a graded exercise routine. Occupational therapy is a fantastic resource. Occupational therapists specialize in helping us execute our activities every day. So how do I get from point A to point B safely? How do I carry a workload in a way that reduces my energy expenditure, reduces the chances that I'm going to crash or overexert myself? How can I make dinner, or how can I make a meal for myself with modifications that help me reduce my energy expenditure? So occupational therapists are a fantastic resource, as are speech and language pathologists, who also specialize in cognitive rehabilitation techniques that help people with traumatic brain injury and stroke, and can certainly help those of us with cognitive impairments after COVID. Ask for disability accommodations at work. access benefits that you have every right to access, and that can help you live your baseline life. And many people with simple accommodations can maintain their employment and maintain a lifestyle in their own homes. So there are resources available. Please ask your medical team to get you what you need. And then social support, this can be especially challenging. It is very hard to save energy for what's important, because that means you have to identify what actually is important to you and say no to those things that are not as important. Protecting your energy means protecting your health and improving the chances that you're going to recover. Long COVID, once you have it, requires a lot of vigilance, hard work, and patience, but it is possible to regain our health, and I hope that you do not lose hope.
So as you can probably see from that, Dr. Khan is an absolute wealth of information. Please check out her website and her podcast at longcovidmd.com. And we will look forward to having her back, as well as sharing that full video with you soon. So clearly, we need more research, we need more trials, we need more diagnostics, we need more treatments, we need more advocates, we need a better understanding, we need more communication around long COVID and more awareness, and we need more prevention. We need a lot more prevention. The only real way that we know how to prevent long COVID is to prevent COVID in the first place. We know that vaccination before having long COVID reduces the risk of later getting long COVID. There have been repeated trials that have shown this. Every time you get COVID is a new opportunity, not only for a bad outcome in the acute phase of COVID, but also is a new opportunity for long COVID. And we never know which time a person may get long COVID. You may be fine the first or second time you get COVID, and then the third time could be the time when you suffer from long COVID. So we just don't have any way of predicting or preventing that at this point, other than preventing getting COVID. Just a note here that vaccination can reduce the risk of getting long COVID, but it does not mean that it would do anything for you after you have long COVID. Some people do improve getting vaccination with long COVID. Some people worsen, and some people stay the same. So again, long COVID is not one thing. It is not going to have just one intervention. So the main thing that we can do to prevent more long COVID is to prevent transmission. And we know that that takes effort. It means, first off, better ventilation in our indoor spaces. It means a high quality filtration mask when you are mixing with the public or with folks who you don't know if they have COVID or not. So good ventilation, incredibly important. We know that the best ventilation is often outside, but even inside, we can really make big improvements, from some simple adjustments all the way to larger investments. We should be looking at all of the above. Take a look at the places you spend time in, places you're responsible for, and consider how to improve the air quality for everyone. If you are still masking, that is great. Even if you're not, consider wearing a high quality filtration mask in high risk places. Think about crowded settings like airplanes, airports, public transportation, high risk locations like healthcare facilities, and places where large numbers of people from the public are mixing, and where there is a lot of talking or singing, and really any crowded indoor places, but particularly when you are traveling all about, we're wanting to not contribute to all of those chains of transmission if at all possible. And if you do get sick, if you do have symptoms, it is best to isolate, test, and if you're someone who should be treated for COVID, get treated. And remember, if you don't have a primary care provider, please get one. Know how to reach them before you need them. And remember to eat a balanced diet, stay well hydrated, quit smoking, limit your alcohol intake, reduce those simple sugars and processed foods and artificial ingredients. If you're sick, Please rest and recover. We know that pushing yourself and trying to go back out to full steam can actually impair your recovery and may be even associated with post-viral conditions. Otherwise, get some regular physical activity and some fresh air. Manage those stress levels and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us. We'll be taking next Tuesday off, and then we will see you the following Tuesday at 10 a.m. See you then.